So what drew you to full mouth dentistry replacement and reconstruction?
Well, I graduated from dental school and I kind of didn't quite know my direction. And so after graduating, I really had a propensity for surgery. It just really fell into my lap and I was really comfortable with it. And so I started taking CE or continuing education and found that I really loved surgery and the things that I was doing to help people with their smiles and their lives just really attracted me to that part of the field.
Well, it changes lives.
It does. It does.
Really amazing what a smile can do.
It's communication. That's the heart of how you interact with people. So.
Well, so how many full arches have you completed?
More than 100 now, and.
So 100 lives changed.
100 lives changed, yes.
Incredible.
Yeah, it is. It's the most incredible feeling when that patient gets their new teeth and I get to see how it impacts their lives because that story never ends. It's not something that goes away. Most of these patients become family.
Oh, wow. One of the things that I'm wondering about is what is a typical patient that comes through the door? What is the starting point for them?
The starting point's a little rough. Most people are pretty embarrassed and uncomfortable, and they've been hiding their smile for years and years, and they haven't even shown their family. Most families don't even understand where they are, and so by the time they come in to see us, they don't want some strange doctor, picking apart the things that have gone poorly in their mouth, and so. We really try to get people in the door in a comfortable way, in a low stress, nice, easy way, because otherwise it's so hard to make that first step.
Oh, absolutely. I mean, I would imagine that there's a lot of fear involved as well, like embarrassment and fear. Embarrassment
and fear, definitely. And just this overwhelming sense of shame.
Mm-hmm. That's tough.
Yeah, it's really hard to deal with that.
Well, so for somebody that's never heard the term, what exactly is an All-X?
So an All-on-X is a dental implant procedure. The old coined term, the brand name term was All-on-4. So we would place 4 dental implants and we would give a whole new a bridge of teeth to go on top of that. And now with the new advents and the advances in dental implants, we've found that 6 implants is kind of our ideal, 4 to 6 implants. So we say All-on-X because it's an arbitrary number.
Okay, and so what is the difference in dentures and an All-X?
So dentures are a plate that goes in the mouth and it relies on the suction of being able to attach to the tissue, which there is none. So most people are using glue and things to keep the denture in. The denture has no permanent reinforcement. It's just there and you're taking it out at night and it's not doing much to improve your chewing.
I remember my grandpa had dentures and I remember him chewing and he complained about it hurting rubbing and it was just an always issue.
I always tell people it typically becomes a pocket ornament. You wear it when you're taking photos or you're at family dinner, all those times that it's more intimate and you're conversing with people. And then when it comes to actually chewing food and utilizing them, it's pretty difficult for patients.
Yes. And so how does the All-on-X change that for a patient?
Well, we get structure back. We get a foundation back. We get something to hold that in place and it's permanent, so you don't have to take them out. These implants are going into really solid bone in different parts of the face to give you the retention and the ability to chew at 100% of what you had when you had your natural teeth.